Now, without further ado, I'd like to introduce our presenter today, which is Kimberly Timpf, my colleague here at EVERFI. For those of you who may have not been on Kimberly's webinars before, Kimberly is a Senior Director of Prevention Education here at EVERFI, and she has more than 20 years experience in the college alcohol and other drug prevention field. Having worked at both public and private universities, she has authored and managed federal and state grants, coordinated nationally recognized prevention programs, and served multiple terms as the Directorate Chair of AUD Issues for ACPA. At EVERFI, Kimberly serves as a subject matter expert in alcohol prevention program design and development, application of prevention theory in higher education settings, training and instruction, and methods of evaluation. And that is the reason why we asked Kimberly to present today on how to implement an evidence-informed prescription drug abuse prevention program, and also offer a little bit of an overview of EVERFI's new prevention course in this area. As you'll notice from this first slide, we've also selected two hashtags that we would like to encourage you to use in case you're tweeting about this event today. One is hashtag evidence-based prevention, and the other one is hashtag prevention matters. So if you are going to tweet, please use this hashtag. We'd love to see your tweets and engage with you on Twitter as well. After this brief introduction, I'm ready to hand it off to Kimberly. Kimberly, are you there?
I am. Can you hear me?
Yes.
Great.
I can hear you perfectly.
Thanks.
Take it away.
Okay. Thanks, Kaylee. Thank you so much, everyone, for joining us today. I see a number of colleagues on the line here. They're signing in even as we speak. Chris, Austin, and Alicia Smith, Asher, University of Arkansas, Jennifer Shipley, Marcy, Bernie. Hi to everyone. I haven't seen some of you in a while, so it's nice to see at least your name on the screen, and appreciate that, the folks that are joining us today. So I am delighted to be hosting this webinar to give a bit of a glimpse into our latest course, which is aptly named Prescription Drug Abuse Prevention. So it does describe exactly what the course is. And during this webinar, I'm going to highlight some of the key challenges specific to addressing this issue in the college environment, because I think in addition to just learning about the course, it's really important to have the conversation about where a course like this will fit in broader prevention efforts, and some of the scope of the challenges around this issue that have come up, and how that has informed much of the course development. So I do want to talk about addressing this in the college environment, opportunities to frame the issue in a way that can help prevention folks drive a campus-wide buy-in to address prescription drug abuse prevention. I'm also going to be sharing how our traditional prevention theories and frameworks have informed this latest program, and take a little bit of a closer look then at several of the key course components designed to support those various learning objectives behind the course development. And I'll show you some screenshots, and from just in terms of ability to show I'd love to be able to show videos and have it be a little more interactive, but we can't be assured that won't crash the system. Best laid plans and all. Sometimes we would love to do that, but want to make sure that we at least give you a sense through some type of visual, even though it may not be excuse me, the specific interactive exercises. And then finally, my colleague George Homer is going to take a few minutes to walk through some of EVERFI's latest prevention and compliance course offerings, just give a brief overview of where the course fits within that catalog. So first, let's start with something I always like to start off with, which is the scope of the challenge here. So, prescription medications do play a critical role in healthcare, and advances in drug discovery and development certainly have helped millions of people live longer and healthier. I think specifically, and one of the examples we use in the course is insulin and other drugs that have been developed to help folks with diabetes, with high cholesterol or heart conditions, and some of those. But any medication it really, when misused, can also cause harm. And so there are some specific ways to avoid that harm. And there are a number of factors that have driven misuse and abuse of prescription medications that have kind of, overshadowed this idea that they can be used safely. And sometimes, we need a reminder of that. But it has caused this to become one of our nation's most critical public health challenges. I think specifically about recent news, and one need only look as far as the latest news headlines, blogs, or in this case, New York Times bestseller list to see the attention that this issue has garnered on a national level. And I have this example up here as a book. If folks have not read it, I really do highly recommend. It is a great read and gives a really helpful and important perspective around what has contributed, using the case of a town in Ohio as kind of the hotbed of how this has this issue has grown and developed. And even the White House panel examining the nation's opioid epidemic told the president to declare this a national public health emergency in order to combat this ongoing crisis. And I think the one in this particular article, the one quote that stands out to me is that America is enduring a death toll equal to September 11th every 3 weeks. So if we in prevention do a lot of assessment, like to think about this in numbers, or these issues in numbers, especially for our particular campus. But I think that this is really, again, attention grabbing, something that does bring home the seriousness of this issue. And there were a couple articles earlier this year that stood out to me as well. This one equating the opioid epidemic as this generation's AIDS crisis, with 52,000 people dying of drug overdoses. These are stats from 2015, but that's more than the peak year for AIDS, which was in 1995. Then within a few months after that, the New York Times published an article noting that in 2017, based on the data that they could compile, that overdose deaths most likely exceeded 59,000. So in 1 year, that is a tremendous increase, the largest annual jump ever recorded, and looking at the leading cause of death among Americans under 50. So, I think interestingly too, if you look at that first article, we have seen, cases of HIV increase, as we have seen, greater increases in particular with use of heroin. And unfortunately, it feels like we're sliding backwards a little bit on that front. And so, so this is something that is clearly out there and has, the attention of a number of folks. And when we think of what is contributing to this, like many challenges in our society, this has, kind of shown itself on campus, and I'll talk a little bit more about that in a moment. But I think when we look at the number of factors that have driven misuse and abuse, the first thing that stands out to me is when we look at data like this or studies like this, that 5%, or the U.S. represents 5% of the world's population, very small percentage, and yet we consume 75% of the world's prescription drugs. So that's, I think, a really critical part of this conversation as well. We look at contributing factors to prescription drug misuse, and that first piece that I just mentioned, first we think of access, the access to prescription medications, with 4 billion of those filled each year in the U.S. Ads is another important piece, the marketing. The U.S. is one of 2 countries that allow direct-to-consumer advertisements for prescription drugs. And finally, misperceptions abound. We see this a lot in a number of other substances as well. But much of this access and marketing, has driven a belief that prescription medications are safe because a physician prescribes them. And I will say one caveat to that: it's an incorrect belief that prescription medications, I would say, when taken without a prescription, or when not taken by the person having the prescription, who's the prescription is prescribed to, are safe. And so, they're, explaining that or kind of pulling that apart a little more is important part of that conversation. Ultimately, this has driven this belief there's little negative stigma attached to taking pills in this society. The challenge is that oftentimes it does not stop with the pills that are prescribed, and that is where we are, looking to make, to make progress in terms of preventing this from gaining more momentum, particularly on our campuses. So let's talk about that, prescription drug use on campus. And as I said, like many challenges in our society, the prescription drug crisis is currently playing itself out on our nation's campuses. As we are microcosms in terms of being small communities, the extent to which that's happening is really hard to determine. And I'm going to talk a little bit more about that in a moment, but it doesn't mean that it's not worthy of our attention. Certainly we want to get ahead of this and not be reacting to it when we are looking at our populations on our college campuses, our students. So, now more than ever, students are coming to campus already taking a number of these prescribed medications for things like anxiety, depression, ADHD, as well as prescriptions for drugs that are typically not abused. So again, lots of, leading to that lack of stigma around medications, specifically taking pills. And so, while the majority of college students will never abuse prescription medication, certainly misuse of these substances is on the rise and an important part of the conversation. So the most commonly misused drugs really fall into three categories, and you'll see this is, again, an area that has informed the content of our course, and this is where we focus. And first, of course, are the stimulants, and these are those medications used to treat attention deficit hyperactivity disorder, ADHD. They appear under the names Adderall, Ritalin, Concerta, and then the newest drug on the market is also Aptensio. That's not written here, but that is out there. And these drugs increase alertness, attention, energy. At the same time, it can increase blood pressure, heart rate, chances of having a seizure. Stimulants actually are one of the most commonly misused drugs in the college student population, and so you'll hear a little bit more about that momentarily. At the same time, we also have depressants, those drugs used to treat anxiety. So depressants, benzodiazepines. These drugs work by keeping stress-related nerve impulses at bay, and so they can cause drowsiness, they can cause seizures from withdrawal. So the good, measured with the bad, and this is why, again, reinforcing for students that these drugs can be used, but must also be used under the care of a physician or other medical professional who is has the ability to prescribe medications and do the appropriate background checks and take an inventory of other health-related behaviors that an individual might be experiencing. And finally, there is opioids, and this is, what we've said has been all over the news, particularly in the last few years, especially, the past couple of years with the death of several, famous actors and/or musicians, and this kind of has come to the surface afterwards. These drugs are used to control pain, and they affect regions of the brain that trigger euphoria, which is why they can be so highly addictive. They also cause drowsiness, slowed breathing, respiratory depression, and death. And this is, when we think about the potential impact of these drugs, certainly the extreme is potential and is true in terms of the potential to be life-threatening and life-changing. Also so I mentioned the opioids, but I also, when we look at national data, in this particular slide from the National Institute of Drug Abuse, there is a clear and justifiable concern around the dangers of opioid abuse. And so, that nationally is more likely than other substances to lead to addiction, overdose, and death, as I just mentioned. And it is stimulants that are being misused and abused at the greatest rate. So when we break this data down and look at college students versus all 18 to 25-year-olds, we do see a slightly different story. This survey asked, have you ever used the following prescription drugs for non-medical reasons? And when we take a look at opioids and depressants, college students are using those at lower rates compared to the general 18 to 25-year-old population. So then you'll notice that students, however, report using stimulants more than the other two types of drugs. So when we look at that percentage difference between college students and all 18 to 25-year-olds in that stimulant category, it's more than double the percentage. So that's where there's a little bit of a disconnect between what we see nationally, what we see on campus, but again, that doesn't mean it is not there or doesn't exist. It also can potentially mean that we're not seeing it, it's not visible to us because of the resources that these students may be seeking. So there was an interesting piece, Melissa Korn and John Camp from the Wall Street Journal had a feature this past May about the rise in opioid deaths among teens and young adults, and specifically the mystery surrounding how widely these drugs are being used on college campuses. And they kind of likened it to, is there a hidden crisis? And, some of the things that they pointed out were that if you look at the 33,000 people in the U.S. who died of opioid overdoses in 2015, and again, that seems inconsistent with that number that I showed earlier from the news article, and that's because that was all drug overdoses. This is specific to opioids. So if you compare 33,000 out of 52,000, you can see the proportion that have been attributed to opioids versus other substances. But college students are as likely as others to abuse narcotics. And this was a survey that was commissioned by the Hazelden Betty Ford Institute for Recovery and the Christie Foundation back in 2015. It was a survey administered to 1,200 students nationally. So this is what they were able to find in their particular study. And then lastly, there's another challenge, is that federal law does not require colleges to report drug deaths unless they're deemed criminal. And I would say add to that, which wasn't noted in here, is what I mentioned previously, which is that, certainly these may be happening, or drug overdoses may be happening off campus where we don't necessarily have information or data. If we don't know, from local hospitals, it kind of underscores the need to be working within the community to try and collect information in order to assess the extent of the issue on a given campus. So that's something that I think is really important to this conversation. It's also, important, to not forget that prescription drugs, just as alcohol, do also have clear connections with other drugs. So with changes in state laws around marijuana use, it's helpful to remind ourselves of that prescription drug use does not exist in a vacuum. This is a study from Project Farm, Jason Kilmer has presented on. Some interesting food for thought around, and highlights the need to really address the effects of, the interactions between use of when using multiple drugs. So in this case, we look at students who did not report using non-medical use. It's kind of a double negative, but if students did not use prescription stimulants in a non-medical way, only as prescribed, in other words, you see past your marijuana use, past 30-day use, and skipping class. So the academic impact of that is presented here. When you look at those who reported past year who did use prescription stimulants in a non-medical way, you see past year marijuana, use more than doubling, past 30-day marijuana use tripling, and then skipping at least one class. And again, there are some distinctions here with the percentages that are due to alcohol and other substances. So you see that even among those reporting on the right graph, even more are reporting that is due to alcohol use, even compared to those who did not use in a non-medical way. So I think as we kind of tease all of this out and think through, what does this mean for our campus, it's clear that, the issue is there. The argument can be made for the need to address this issue, but the challenge becomes how. And so where do we get started? While we're used to having, or most of us, and I will say, I don't want to make that assumption for those on the line, most of us, I would say those who have done this work for a number of years, are quite used to having multiple conversations about alcohol with campus constituents and, framing, our conversations. And this, however, is an altogether different talk track. So how do we use what we know to frame those conversations while also considering the distinctions that exist? First, I would say it's important that folks understand that prescription drugs do have a therapeutic benefit versus alcohol, although some might, argue that point for different reasons. But we don't want the outcome of our prevention efforts to make students fearful of using drugs that are prescribed by their physician. So we do need to incorporate strategies that consider this important piece of information. Next, alcohol and other drug prevention really is the most recognized descriptor. AOD is the recognized descriptor, but alcohol has really been the focus of most of this work for decades. And even today, the percentage of students abusing prescription drugs is much lower than the number of students abusing alcohol. So many people think, okay, this correctly is where we need to be focusing our efforts, and that is definitely true. But the challenge becomes that we need to not stop doing what we're doing around alcohol, but we need to broaden our lens. And there's some particular challenges, of course, that come with that. But I think other drugs now is in the spotlight, as it hasn't been for years. The pharmacological risks, associated with overdose, death, permanent brain damage are clearly much greater for illicit drug abuse. So while there are smaller numbers, the outcomes are much more grave, and that needs to be considered. Another piece is similar to early alcohol prevention efforts. Professionals who, I think back to the days of FITSI, for those of you who can remember that, and the national meeting that those of us who were grant funded were required to attend. There was no kind of professional development around prevention, and while it's definitely limited today, there are other opportunities for folks to get that type of training. But with prescription drug use, many of the professionals working in this arena come mainly from a treatment background. So strategies for treatment and referral have gotten a lion's share of the attention, and I would say resources, which is important, but only part of the conversation. So prevention strategies are a more difficult conversation for student affairs professionals for a number of reasons. One of those is that prescription drug abuse is associated with negative stereotypes, similar to early alcohol prevention efforts. Professionals or alcohol use and abuse continues to be seen by many as a rite of passage and even typical college student behavior, whereas abuse of prescription drugs elicits a very different response. I would love to change that perception of alcohol use, certainly, but I think that's what we're operating within, that type of framing. So there is a systematic bias that runs throughout campus culture, and it can often result in withholding support based on socially constructed hierarchies of the types of addiction that are out there, substance use disorders, and what is considered quote unquote worse or less desirable, in terms of, who administrators perceive as being okay to be part of our campus community. And that is certainly things that I've heard out of folks' mouths about concerns about addressing this, and concern about even having the conversation, implying that we have quote unquote drug addicts on our campus, which is certainly something that we need to move beyond and address. And finally, much of this comes down to, and all of it said, is there is still an institutional expectation that student affairs will develop the effective strategies to reduce incidence of prescription drug abuse. So unfortunately, this may be and is an unfunded mandate. And I'm going to talk a little bit more specifically about that in just a moment. So the challenges that arise out of all of this that we just need to keep in mind and kind of keep to inform these conversations is that while there's consensus among campus stakeholders often about the risks of prescription drugs, there is a lack of consensus about what to do when it comes to prevention. Many conversations on campuses happening around whether or not Narcan should be made available. Narcan, which reverses the overdose, the effects of overdose, opioid overdose. And the amount of time and energy that's being spent on this conversation, identifying cost, identifying strategies, you go through the list of what is happening in these conversations, which are very important before making a decision. But I think those same conversations certainly need to happen around prevention, to prevent, strategies that will prevent an overdose in the first place. But much of the uncertainty around creating these programs and policies has to do with a lack of understanding about what exactly we're trying to prevent. So that's why these conversations are so important, and we do need to consider these distinctions. So again, taking a little bit of a deeper look at what I mean by an unfunded mandate. We forget often, the Higher Education Act of 1965 was amended in 1989 to the Drug-Free Schools and Communities Act, and this requires that any institution of higher ed that receives federal financial assistance, which is all but one in this country, need to adopt and implement a program to prevent the use of illicit drugs and alcohol abuse. So again, we go back to the language specific to illicit drug and alcohol abuse by students and employees. So having a compliant program requires that institutions of higher ed prepare a biannual review report on the effectiveness of its programs and policies, which includes consistency of policy enforcement, and then annually distribute specified drug and alcohol prevention information. This is otherwise known as annual notification. And some of the specific requirements of that are that institutions must share standards of conduct, federal, state, and local laws, the appropriate sanctions for violations of federal, state, and local laws, a description of available treatment programs and other, related, those who are seeking help, and a description of the health risks associated with alcohol and other drug use, and it specifies the 4 areas that campuses should be providing this information about. You see that listed here. So while there is a clear mandate from the federal perspective, resources, again, are most often directed exclusively at alcohol abuse prevention, and those resources should not be diminished in order to address other drug use, but we all know the challenge associated with that. But it's not, again, that alcohol prevention be deprioritized, but that we start to spend, more time and effort and attention on thinking about how we are addressing the other drugs piece of this equation. So to answer the question again, another answer is to where do we begin? I have offered that we first need to, start having these conversations, if we haven't already, with the appropriate people and stakeholders on campus, framed in a way that recognizes these distinctions that can certainly drive a lot of questions among administrators. And the next step is to really use what we already know. Traditional broad categories that we often think about when creating prevention initiatives are common across a number of frameworks like the socio-ecological model, public health model, Institute of Medicine's prevention protractor model. I'm happy to share more on those specific frameworks for those who are interested. I think those are probably familiar to most. And again, what they have in common are strategies for information dissemination, skill building. How do we disseminate critical information, give students the opportunity to develop these skills, in this case specific to prescription drug abuse prevention, where we include strategies specific to problem identification and referral. So as you'll see in a moment, the data and custom messaging in this course provides institutions with critical information to help drive the other 2 important areas, which is looking at campus-based processes and informing a broader environmental approach to prescription drug misuse and abuse. And so that is ultimately where we're looking when we start thinking about, how do we incorporate, again, those top 3, the information dissemination, the skill building and potential skills around, recognition and referral. And the course, which I've been referencing, of course, throughout, pays particular attention to how how it can assist campuses in reaching these 3 critical areas. So I want to start by looking broadly, in building this course, we were fortunate to have the assistance of several leading professionals and researchers who've been giving a great deal of thoughtful consideration to addressing prescription drug abuse, misuse and abuse prevention. And again, happy to share information about those individuals. If you would like to know more, we have folks who are working on campuses, and again, I said, as well as researchers. But the course curriculum overall really is informed by the same evidence-based strategies incorporated in the development of alcohol EDU. So it applies principles of social norms theory to engage the healthy majority of students who don't misuse or abuse prescription drugs, challenges misperceptions about the prevalence of use and the acceptance of prescription drug misuse and abuse. We provide opportunities to identify and learn bystander intervention strategies to help students recognize signs of potential prescription drug misuse and abuse, and build self-efficacy around assisting someone who may need help, who may be struggling with their personal use or could be at risk of an overdose. So that's kind of more with a broad brush. I'm going to get into a little more specifics in a moment, but ultimately, this course does provide a great deal of interactive content. It is designed to provide an inclusive experience that recognizes the needs and experiences of a diverse population of learners. That was certainly, key to this, to the development here. And what I'm showing now are just some of the customizations that are available for what we consider in-course customizations to direct learners to appropriate campus and community resources and policies. These are not required. Schools do not have to include them, but we have that option. And then what that does is provide an opportunity in what's called the portfolio for learners to be able to go in and access this information more quickly. The resources, policies in particular, and glossary of terms, as there are a number of terms associated with this, with this topic that can be challenging. And again, we do have, a number of measurements. We do have course surveys and assessments to help identify ongoing focus areas, again, to inform that additional education and outreach, following the course. So again, framing this in a positive way, but also providing information to help campuses understand the scope of the issue at their individual institution. And then also, again, recognizing that there's no silver bullet, that this is a very important opportunity to, again, provide population level information in a way that can be the first step in a broader prevention strategy around prescription drug misuse and abuse on campus. So the other piece that I do want to highlight when we look at customization is we also ask students if they are in recovery, from a substance use disorder, would they like to be contacted? We have this in our alcohol EDU course as well. When students click on yes, they're told that there's no guarantee that they will be contacted, but if campuses are using this, I highly, highly recommend that not be overlooked, as these are students who are, asking, for some information that could be very helpful to them, and to not take that opportunity would certainly, be unfortunate all around. So even if there's not programs available on campus, getting them connected to programs in the community and resources in the community is really important. You can incorporate student policy, school policy rather, which again, going back to Edgar, this is all information that needs to be disseminated. And when you have students who are listed in course completion list as having completed the course, then you do have information showing that the required information has been delivered to students. So backing up a little bit now to dig a little bit deeper on behavioral outcomes and learning objectives. I think an important part of this conversation is to identify that the course is designed to achieve several key behavioral outcomes, and these are the three. Very, very simple, actually. Students who do not currently misuse will continue not to misuse or abuse. For students who do, the behavioral outcome is that we would hope they would consider discontinuing their misuse or abuse. And then for all students, we hope that they will learn how to be an informed consumer of prescription drugs, be able to provide assistance, feel self-efficacy around providing assistance for a friend who may be experiencing a problem with prescription drugs, and to seek medical assistance for someone who may be experiencing a drug overdose. Each of these behavioral outcomes is supported by a set of learning objectives, which are linked to individual level factors that influence behavior. And these can be grouped into 8 categories. And these 8 categories are derived from 3 seminal behavior change theories. So first we see the health belief model, theory of planned behavior, and social cognitive theory. Those 8 individual level factors are knowledge, attitudes and beliefs, perceived outcomes, personal norms, social norms, behavioral skills, perceived behavioral control, and cues to action. I will say the cues to action are not incorporated into the course itself, but we provide recommendations and suggestions for what those could potentially be as a result of the information. So how to follow up and potentially see some actionable items related back to what students have learned in the course. Now, I'm not going to, there's numerous objectives under each of these areas, so I'm just going to highlight a couple of them to give you a sense of how we have incorporated these into the course content. So for knowledge, essentially knowledge, very important points of knowledge include the seriousness of prescription drug misuse and abuse, and a focus on the physical, academic, and legal consequences, as well as the benefits of prescription drugs when used appropriately and under the care of a physician. Availability of resources and other key facts around the types of drugs and side effects, etc. So a couple of the objectives here, some sample objectives under knowledge, are to identify the attributes, describe the risks, cite laws and policies. And so the course incorporates, again, those 3 categories that I mentioned earlier. We focus on these 3. Students can select each category to learn more, and it basically brings them to a page where they can click on each of these tiles to understand and dig a little deeper on the more specific information. So as an example, looking at specific signs of abuse for depressants and benzodiazepines, it gives essentially some of the same information that I reviewed previously. We talk about legal risks and consequences. Beyond just state to state and federal legal risks, we also talk about driving under the influence, driving while intoxicated, driving while, after using any kind of drug, which includes marijuana, and what some of the laws are around drug blood testing for substances and that type of thing when impaired driving is a possibility. So we get into a number of those pieces. Looking at behavioral skills, so we know that people are more successful in changing their behavior if they have self-management skills and can self-assess their skills. So certain behaviors may require more specific skills, such as knowing how to refuse requests for others to use personal medication. So that's one of the behavioral skills objectives, is to demonstrate how to refuse requests. And we address that through activities, with, in this case, a video. I think this is Jillian. I'm not sure, but that may be the case, where Jillian approaches you as the learner, approaches the learner in the video and says, hey, our mutual friend told me that, you had some pain medication that you hadn't finished, and I have some back pain that I really, I don't want to have to go to the doctor. I don't have time, and et cetera, et cetera. So can I, have one of your pills? Would you share your medication with me? And so there's then options that you as the learner can select. And here you see 3 examples, and based on what they select, you see, the response. It's either affirming, and I don't show it here, but even when it is not the correct or appropriate answer, there is information and reasoning behind why that was not the correct response, and how to think about this differently. So this is a video. This video also goes beyond into looking at some other aspects of her life that you don't know about when she is just initially asking the question, that really does get students hopefully to think about it's not as easy as, oh, just give someone a pill for pain. There are other extenuating circumstances that you may or may not know about that is really important, and that's why this is the most appropriate answer. Another behavioral skills is how using non-confrontational responses to turn down an offer. In this, it's called the study skill, or I'm sorry, the study group case study. And Jax, who is in the foreground here, says, hey, I'm not going to make it through this test. I'm not going to be able to do it without some help. I can get some Adderall. Does anyone else want it? And so you see here, you can select each individual to see what they're thinking, because oftentimes that's really where it all starts is, what are students thinking in their heads when they hear that? And then they start running through the scenarios of how do I respond and what can I do? And so here you see Jax ask the initial question. I'm going to show you kind of what Rachel is thinking and how we dig a little deeper with Rachel on this. And so, she says, hey, does this stuff actually work? I could really use some help. So we go through, again, some information, some knowledge that relates back to some of those knowledge objectives. But then we say, what would she say, or how could she respond to Jax? And, there's three options here. I'll show you how we would respond if what we would consider quote unquote incorrect option, not quite. We don't want to leave, Rachel doesn't want to leave the door open for a next time. And that's why throughout we recommend that responses really are simple and direct, not leaving the door open, not insulting or judging, really being very just clear and firm. And in that way does not necessarily, in hopes that it will not bring up follow-up questions that will be challenging. And there are also, we present other options as well if that is the case. So perceived behavioral control is the next area I'm going to look at. I think the last that I want to give as an example. And this is thinking about how we are more likely to engage in behaviors when we believe we're capable of doing so at particular times and in places, and where we can call upon, learned strategies to overcome some of the barriers that we might face. So in prescription drug abuse, one of the objectives in this area is to help students agree that they will use prescription drugs only as advised by a doctor or medical professional or pharmacist. And one of the exercises to meet this objective is actually probably one of my favorites, and again was an idea of one of the folks who served as an external subject matter expert, which is how to read a prescription label. And that might seem simple, but I think it's a really important part of educating students. So you see here, we have, a typical prescription label, in this case for oxycodone. I've highlighted as you scroll over each, number, it presents more detailed information about what that is. So the directions are to take medications exactly as prescribed and why they are prescribed a certain way and how doctors or physicians consider that in prescribing this medication. So we then go to a case study. We ask several questions based on information on the label. In this case, I'm showing you that the example where Ashley took a pill at 8 p.m. When's the best time for her to take another pill? The correct answer, of course, is 8 p.m. if her knee begins to hurt. Again, we say, taking before then could be risky, even if some discomfort, but again, need to follow doctor's orders precisely. And if there is continuing pain, that she needs to talk to her doctor or prescribing, physician or, excuse me, pharmacist, if there are questions. And we consistently go back to that recommendation. Another, area that we look at is the legal notices. So there's 3 different screens that look at all the information that is provided on these labels and why that information is there and why it's so important. One of the cues to action that we have discussed would love to see is students taking a snapshot of their prescription label and being able to reference that at times, keeping that on their smartphone and being able to reference it if they ever have any questions. And also if they need to prove that any medication that they are taking, they may not have the original bottle for, that it is indeed prescribed to them. So, those are opportunities, I think, that could be addressed in follow-up. So ultimately, prescription drug abuse prevention is designed to disseminate accurate information about prescription drugs, and we really, with the intention of helping students to make informed decisions about their personal use, as well as risks, as well as the risks associated with that, and then also assisting those who may be misusing or abusing prescription drugs themselves, and what that means and what some of the referral options and resources are on campus. The curriculum is really intended, it's grounded in behavioral change theory, and we've incorporated evidence-based practices. So hope, again, central to this is the engagement of the majority of students that we say over and over again are making safe and healthy decisions. But we really do want those students to feel empowered, to create a culture that discourages misuse and abuse of all substances ultimately, and provide the motivation that students need to protect their health and safety. And importantly for our practitioners is to provide that critical data and student engagement information to help inform prevention strategies more broadly moving forward. So thank you for your attention. I do, as I said, want to now turn this over to my colleague, George Homer. I'm going to take questions after George briefly goes through the course catalog and again, gives folks an idea of where this sits in terms of what the offerings are. So George, I'm going to turn over to you. I still have control of the slides, so go ahead and take it away.
Thank you, Kimberly, for providing this presentation today, and appreciate all you folks joining the call from your busy schedule. So due to the number of people that are in attendance today, we know how important this topic is to you, and equally important to EVERFI. And so just to give you folks a quick background on myself, I'm George Homer. I'm a vice president here at EVERFI. I spent the last 10 years helping campuses with compliance and prevention training. And so as many of you know, 1,700 campuses are using EVERFI to address these critical topics. And so we owe it to the market to do this right. And so our commitment to the market is no longer providing a per course a la carte offering, but to provide an unlimited access model with additional courses included in the subscription at no cost. And so many of you folks on the call have the site license package, and many don't. And so for the folks that do have the unlimited access subscription model, if you'd like to demo access to this course or review the course, please type demo into the question box, and I'll have your customer success manager reach out to you with course access and a plan to utilize the program in your existing membership. I know about a third of the folks on the call either don't have the site license subscription model or don't have a relationship with EVERFI. And so if there's an appetite to review the course or have a conversation about what the site license model looks like to see if this is a good fit, please type site license into the question box. And just to give a quick overview of the site license, and so the site license is similar to the subscription services that many of you folks use regularly, like Netflix, which new products and services are added into the subscription with no cost for usage. And so the slide that's up right now, these are the site license student prevention offerings. So alcohol EDU, primary haven, prescription drug abuse, ongoing sexual assault prevention, ongoing alcohol abuse, sanctions courses. And what's really awesome about the site license, as we develop new courses, such as a new data security course for students or a new diversity course for students that's coming out in 2018, this would be included in the subscription at no cost. And then we also have, and I know that this next slide won't be in most of the folks' wheelhouse who is on this call, but we also have a site license membership for employees that addresses critical prevention and compliance topics like sexual harassment prevention, sexual assault prevention, for protecting minors, data security. And so these are additionally a site license model for employees that would be available to address best practices. So if folks think that this could be helpful or maybe a good fit, once again, please type site license into the question box, and myself or someone else on our team will reach out to discuss populations, needs within the institution, and the value and pricing of this opportunity. So I thank you for allowing me to mention what this looks like and how we're helping campuses. I'm going to turn it back over to Kimberly to field some questions that you folks may have.
Great, thank you, George. And there are a few questions here that some really great ones. And if we don't get to everything today, our intention is to actually respond to all the questions, and we will send out those responses to everyone. Oftentimes, folks ask questions that we don't think of at the time, and so it's helpful to see how other folks are thinking about this. We've just started doing this recently. So this question is, how might using the strategies of the anti-smoking campaign, RE Big Business is making a sucker out of you if you buy their product, how could this be used in this realm? Because Big Pharma is a piece of this puzzle. And I definitely agree. And I think that's a great question. You know, when we put these courses together, we do a lot of vetting from schools as to what information they would like to see included. And we do talk about that issue in the Alcohol EDU course, but that was not within the scope of this course in order to keep it to 30 minutes. And that is actually in response to another question someone asked, which is the length of the course. And it's designed to be 30 minutes in length. That, of course, doesn't include students going into policy or resources and reviewing those resources. So content-wise, the course the content of the course is 30 minutes. Again, something that many campuses you know have requested in terms of length of courses. So we are trying to stick to those shortened versions of a number of courses as we move forward. I'm trying to go through some of these questions, these other questions as well. Let's see. I'm going the wrong direction. Okay. In regards to the percentage of misused prescription drugs among college students, what were the details of the sample group? So I think that's in reference to that study that was commissioned by the Betty Ford Institute for Recovery, and there were no details provided. I mean, there is a link if you go, and the link to the actual Wall Street Journal article is in there, and the citations for the study are. I know it was 1,200 students nationally that was you know, distributed, and I'm not sure if that is the specific question, so feel free to clarify if there was something else that you were looking at in terms of the data. You can also reach out to me, and I just realized too, I apologize, I usually put a thank you slide at the end and did not do that, so did not provide that, but my contact information is Kimberly at EVERFI. It's very simple, but Kimberly is spelled Kimberley. So make sure that extra E is in there if you want to reach out and ask specific questions. I'd be interested to hear some comments regarding strategies for implementation of this program on campuses where Alcohol EDU and Haven are already implemented. So who would we target? How would you recommend communicating this requirement? So what's great about this is another great question, important question. We are in the process of beta testing this with a number of campuses right now. And one of the reasons we do beta test is not just looking at the course content, but also being able to work with campuses to identify how, you know, best practices for implementation. I will say that the schools currently, the majority of them are implementing with their entire student population, so not just first-year students. Some are doing it with just first-year students. Some of the practices I wouldn't necessarily recommend, so don't want to mention specifically. So I think I can look into that, and I can ask some of our customer service folks who are working with schools who are beta testing the course, what they, excuse me, what they are hearing and how their schools are implementing, and I can provide that in follow-up. Similarly, what are the universities that are currently employing prescription drug misuse prevention? So the schools are, at this point, I'm not sure what we're sharing in terms of who is implementing that, but again, that's something I can follow up on and give you a more direct answer, because I'm not working directly with those schools. Aware of any colleges making this course a prevention portfolio course as a requirement for students who are prescribed a stimulant. That's actually a great idea. Have not heard of that, but I definitely like that. If we have that type of information, I think if schools have that information, certainly that's a very interesting approach. Or students who are prescribed depressants or opioids by Counseling Health Center on campus. So, there's certainly some implications there about sharing information, but could go through, counseling. I do like that recommendation as well. So I wanted to read that more to have folks hear, what some of the questions are that people are asking and providing. My hesitation in going after this issue, similar to tobacco, is that these are substances that have medical benefits, and we risk stigmatizing anyone who uses these drugs properly to manage serious health issues. And I totally agree, which I think is why there's such a focus on framing this as, first of all, majority of students do not misuse or abuse, but also going back to, again, not being able to show you the opening video and how we really, introduce the subject is through the lens of these drugs are beneficial to people, and there are people who really need these drugs. One of the scenarios actually is a student who is choosing after surgery not to use their pain medication because of concern over becoming addicted, and we address that as, choosing not to use that is certainly a personal choice, but that is not a recommended strategy, because there's a lot of reasons why, pain management is really important to the recovery process. So that's a great opportunity to, again, incorporate information in follow-up programs. And I think that's a piece of this, again, is this is not the only piece of, this is not the only information that students should be receiving on this topic. And that is a critical part of the follow-up that should need to happen. So I understand the hesitation, but did want you to know that it is something that we have considered. I'm going to just respond to one more question. Oh, that's the same one. Never mind. We will be sending the PowerPoints, and I see a number of folks who are inputting information on demo or site licenses. And so I think that, and those are some of the follow-up for individual campuses and how individual campuses are, have questions about their current license and availability and that type of thing. Nope. That is it. There are a couple other questions, and again, I will provide those responses in follow-up. And thank you so much for joining us. Thank you so much for the thoughtful questions, and please do continue to reach out if you have thoughts or ideas. Once you look at the demo, there are not a lot of changes that we make initially to some of the content, but we keep that in mind for the next update, which is generally happens within the year. So we will be collecting all of that information and data, and it's always helpful unless there's something very significant that we get a lot of feedback on, that we will be happy to go in and see if we have the ability to make a change. So but do provide that input and feedback, including how you're implementing or would like to implement, or questions you have about implementing this course, and we're happy to respond.